What's up, my MAP family? This is Walter Winesberry, the owner of Maximize Autistic Potential. Back at it again on another Saturday. If you need to reach out to me at any point, it's maxautism.com is the website. Maximize Autistic Potential at gmail.com is the email. And the phone number 313-528-9240 is the office number. And 313-247-6169 is my personal cell phone number. So get at me if you want to talk about my favorite topic is autism. And I know a lot of people, to some people that may seem weird because autism is, can be such a devastating condition to the entire family. If you have a child with autism, it can be devastating. And I spend a lot of time on these groups, autism groups on Facebook, and the amount of new parents, parents with 3-year-olds, 3 to 6 year olds, those type of things, 2 years old, and they have no idea about what to do with this condition, And if you think about it, autism's been around a while, but it really didn't start exploding till around the 1990s. The numbers started to go up. Before then, the incidence rates was around 1 in 10,000. Now, it might be it depending on who you talk to, 1 in 50, 1 in 36, or something like that. So the incidence rates have really shot up there, and then we even I think the last time I was here, we talked about there was a 40% increase in the rate among African Americans and Hispanics since 2014. So it's only going up, and it's really disheartening to see, a 2-year-old or a 3-year-old and a parent with autism, and the parents simply have no idea about what to do. So a lot of times in these forums, they're just saying, hey, my baby's doing such and such. He's having issues he would only eat certain foods, principally carbohydrates. How do I get him to eat different foods? My baby not sleeping. How do I get him to sleep? My baby's behaving a certain way. How do I get him to behave differently? And after 30 years, you would think there would be some type of consensus about what to do, and there really isn't. We are really still just the information being presented to new parents is still not sufficient, because it's not I don't want to say truthful, but it's certainly not comprehensive enough to get the give the parent an idea about what to do. How do I relieve some of these symptoms that my baby might have? And many times you go to the doctor and you get these diagnoses. I call them the alphabet diagnosis. So, it could be anything: OCD, ODD, ADHD, ASD, whatever. You get some symptom, some list of what I call the alphabet diagnosis, and they tell you that if your baby has this type of alphabet diagnosis, then these are the symptoms that they're gonna have, and many people take that to believe that these symptoms are, and not just take that to believe, they're being encouraged to believe that this alphabet diagnosis comes with these symptoms, and there's not really a lot that you can do about it. And I think that 30 years after the uptick in autism, if that's what the advice that you're getting from professionals, then you need to start looking elsewhere for your advice. Get a second opinion. Get a third opinion, Talk to a family that has children with autism that has been able to decrease the symptoms, that has been able to get their child to function in a different way, to function more typically, because and the other thing is, the earlier you get on this process, this journey, the easier it is for the child. you know. So ideally, if you can get started around 3 years old, that would be great. Now, that doesn't mean that if your baby is 9 or 16 that there's nothing you can do. It just means that autism, from my experience, is a progressively injurious type of situation. So the injury gets worse over time. So if you get to that child early enough, before all of the injury has taken place, then there's a good chance you can undo this. And through nutrition, we've already talked about that on another podcast. I think it was Dr. James Adams talked about the success that he had using nutrition to reduce the reduce the symptoms of autism in a 12-month study. I think in 12 months he got like a 2 years worth of growth or something like that. So yes, nutrition can be used to reduce the severity of autism. But I think that even before you can get on the journey of using anything to reduce the severity of autism, you have to believe that this is a journey that can be beneficial for your child. So with all the camp out there, the neurodiversity camp that want to celebrate autism, and they believe that this is their child was born this way, and all you can do is celebrate them, and even the attempt to heal that child is somehow looked at as some kind of affront to the child, something that's negative toward the child, making the child feel a certain way, like I'm not good enough as I am, that type of thing. So those, to counteract that, I like to look at the science, because to me, that's just opinion. Now I guess you can find scientists who believe that will prove or have proven in their opinion at least that this is a genetic condition, that it starts but in the womb. That they have some scientists say, hey, we've seen certain things, abnormalities or certain differences in the womb, and this is proof that autism starts in the womb. And all I can say to that is that the incident rate, that of course applies that it's a genetic condition, and genes don't change like that in the short term that they change. So imagine a 1 in 10,000 rate of autism at 1 year, and then a few years later, in 1985 or whatever it is 1 in 10,000, and 1995 is 1 in 160 or 250, whatever that is, and whatever that may be. So that's not possible. When we're talking about the genes changing, they don't change that quickly. So that implies that there has to be an environmental agent that happened. Something environmentally happened to these children, and whether that happened in the womb or outside the womb, that's up to debate for the debate. But something happened to change what's happening in these children's bodies. So I've compared to recently. I was offered a position, a short-term position, 9 months, and I was excited about taking that position. And as I have said, in April 1st of 2020, I believe that I had some coronavirus symptoms, and those symptoms have persisted even to this date, despite all the natural things that I've been doing. But as it came closer to finalize and sign the paper saying that yes, I'm going to work for this particular company, I realized that physically I just could not do it. I was, basically just exhausted. After sleeping 5 or 6 hours, I would wake up and stay up for a couple hours and then go back down for another 2 hours. So physically, my biology was not well enough to take the job, so I didn't take the job. So I compare that to a child with autism. They may want to behave in a certain way, but their biology simply does not allow them to do so. Okay, so today I'd like to go over some of the science, some of the studies that have been used with children with autism. because as a person who learned how to study science, or learn the science of studying science, so to speak. I like looking at science, so let's just get into some of these things because, as I said, what you need to do is to change your mindset so that you can get on a road to healing as soon as you possibly can. So this was, let me see. It says short-term benefit from oral vancomycin treatment of regressive onset autism. This was done back in 2000, I believe. Trying to find a date on here. Yep, and done in the year 2000. So this is the abstract. In most cases, symptoms of autism begin in early infancy. However, a subset of children appears to develop normally until a clear deterioration is observed. Many parents of children with regressive onset autism have noted antibiotic exposure followed by chronic diarrhea. We speculated that in a subgroup of children, disruption of indigenous gut flora might promote colonization by one or more neurotoxin-producing bacteria. So that means toxins that affect the brain, contributing at least in part to their autistic symptomology. To help to test this hypothesis, 11 children with regressive onset autism were recruited for an intervention trial using a minimally absorbed oral antibiotic. Entry criteria included broad-spectrum antimicrobial exposure followed by chronic persistent diarrhea, deterioration of previously acquired skills, and then autistic features. Short-term improvement was noted during clinical psychologists blinded. Short-term was noted using pre- and post-therapy evaluations. So in other words, they determined how well these children were doing based on testing them before and after the therapy. These included coded, paired videotapes scored by a clinical psychologist blinded to treatment status. These noted improvements in 8 of 10 children studied. Unfortunately, these gains had largely waned at follow-up. Although the protocol used is not suggested as a useful therapy, these results indicate that a possible gut flora-brain connection warrants further investigation, as it might lead to greater pathophysiological insight and meaningful prevention or treatment in a subset of children with autism. So again, this was done way back in 2000, the year 2000. Basically, they took 10 or 11 kids, gave them vancomycin. What they found out is that while the children were on the vancomycin, they got better. And when they stopped giving the vancomycin, the children got worse. Okay? So just to be clear, vancomycin is an antibiotic. Antibiotics only kill bacteria. Okay, so there was something some type of bacteria in these children that were killed by the vancomycin, and then the children got better. It's just as simple as that. Now, a lot of people don't know that. I'm sure a lot of families that have children that are wondering what to do would appreciate knowing that type of information. Now, also, they said that this is probably not the course of action to use because vancomycin, that particular antibiotic, can be toxic to the liver. So it's not something that you're going to do on a consistent basis, okay? So that's just one study proving that there's some type of bacteria that once you deal with it, it gets better in children with autism. Now, this next study was done in France, and I think the year 2012. Now, this is really, really heavy. This next study made an impression upon me when I was, looking for what to do for my child. It says, remember, this is 2000. First one is 2000 and 2000 even. This one is 2012. It says French TV station reports on the apparent connection between autism and infections such as Lyme disease. With antibiotic treatment, many symptoms of autism disappear. You hear what I said? They said with treatment, many of the symptoms disappear. Now, I'm going to take take note of this. They said such as Lyme disease. I don't believe children with autism necessarily have Lyme disease. Lyme disease is something that you get that's transmitted by ticks, and most people, the millions of people, 70 million people, I don't think came in contact with a tick. But they said so. I don't think that's necessarily the right way to be looking at it. I think it's more likely that Lyme produces a neurotoxin, and that, as we saw in the other study, that neurotoxicity is involved. Okay. Let's see. Health with this very okay. Will we be able to cure autism thanks to antibiotics? It seems unbelievable, and yet in many cases it works, and symptoms do disappear. This is the hypothesis put forward by some American scientists. They're probably talking about the 2000 study, and some French doctors are also leading the way in the fight against autism. Now, check this out. They took 200 young adults with autism, have already benefited from these treatments. Here is a report of this on the date that they given. From Claudine Gilbert and Antoine, and some French name I can't pronounce. 2 children aged 10 are playing quietly inside the house. They are also chatting together very normally. Normally is in quotes. Commentary. Nothing unusual to be noticed about this young boy anymore. He is chatty, he is at ease in front of the camera. Yet he is autistic. His mother was given an unofficial diagnosis in 2008. After many years of anxious pondering, Alexander had suddenly stopped communicating when he was 18 months. That was the same time that my baby stopped communicating, 18 months. But at that time, we know for sure we gave our baby the MMR vaccine. Alexander's mother, he withdrew into himself. He no longer paid attention to what he was asked. He seemed lost in his thoughts, lost in his own world. We could see he did not pay attention. He did not appear present at all. This is a very, very familiar story. Most of us have this story. Around that time, he also had dark rings under his eyes. He suffered from headaches, eczema, and itching, which made him feel exhausted. Today, his health issues are practically all gone. As well as getting all of his energy back, the young boy has also regained a taste of learning. He owes this complete metamorphosis to a doctor who discovered the culprit for his problems. They mentioned Lyme disease again, due to bacteria transmitted by treating the chronic infections had unexpectedly positive effects. Again, I do not believe autism is due to Lyme disease. Dr. Philip Raymond, a member of a group of doctors and scientists called whatever, Alexander received regular courses of antibiotics. The courses were given regularly during the first 6 months period, but the frequency of the courses decreased after that, and from the second year on, he was retreated. Whenever he relapses, yes, sometimes there are relapses. That's them saying that. About 10 doctors in France prescribe anti-infective drugs to children with autism. The results are amazing. In the last 6 years, 200 children were treated with antibiotics, and 4 out of 5 children saw their symptoms regress dramatically or disappear altogether. Okay, this is the Dr. Raymond. When it works, the results on behavioral and even cognitive symptoms are obvious. I want to point out that in our experience on the protocol, that's very true. Certainly behavior and cognitive gains can be had. Are obvious after only 3 months. In the first month, I am finding that these children already have a more serene outlook on life. They smile, their faces are more relaxed, they don't misbehave as much, they are not as ill. Again, that's what I definitely agree with that. Autism is an illness. Autism is an injury. Okay, so Alexander made amazingly speedy progress at school and also with the speech therapist. The speech therapist is talking now. I can tell the difference between when he has taken a course of antibiotics and when he has not had them for a while. Recently, in the last 2 weeks, Alexander became disturbed again. He was a bit aggressive. He was a bit more touchy. When I spoke to his mom, she confirmed that he had not had any treatments for 3 or 4 months, and that she felt the effects were starting to wear off. so it might be time for him to be treated again, to have another course of antibiotics. In the Paris suburb, Professor Luc Montagnier, this guy is important. This guy is a Nobel Prize winning professor. It says that he's investigating the infectious hypothesis. The researchers has devised a novel method which enables him to detect latent infections in the blood of young people with autism. Professor Luc Montagnier, Nobel Prize for Medicine, we think that they are bacteria that come from the intestinal mucosa, which when inflammation is present, will seep through the very fragile mucosa into the bloodstream and will produce toxins which can reach the brain. That's a mechanism we are looking at, but we don't want to speak of one bacteria in particular. Excellent point. I believe there are multiple bacteria involved in this condition. What we know, though, is that the signals we are detecting usually come from bacteria that are pathogenic to humans. Commentary. This is not a first in medical history. Certain illnesses that were long considered to be psychiatric illnesses turned out, in fact, to be infectious, as in the case of syphilis. Professor Christian Porian, head of the Infectious Diseases Department, University of Hospital of whatever. Another much more recent example is that of stomach ulcers, which were considered to be linked to stress. They were thought to be psychosomatic origin. We now know that they are due to Helicobacter pylori bacterium, which is treated with 10 days of antibiotics. So they've given us two instances in which at some point it was common knowledge to believe that these were psychiatric or psychosomatic diseases, and they turned out to be linked to bacteria. The same will be true or be known to be true at some point for children with autism. And the sooner you as a parent get that information, the quicker you can begin to heal your child. Now, it's unlikely in America, at least, that you're going to find anybody to give you antibiotics for the amount of time that you need to get significant healing or lasting healing, But the alternative that we have come up with, or that I have come up with, is antimicrobial herbs. So you can reduce your pathogen load the way that people have done it for thousands of years before antibiotics. You can use plants, and those plants have the ability. In my experience, my son went from nonverbal to completely conversational. We did that with plants and with nutrients and detoxification. You can do it. It may not. I don't want to say it won't work as well as antibiotics, but if antibiotics is not an option, this can be your best option. So right now we're getting we got 2 minutes left.